My name is James Curtis. This is for SPEC 680 with Dr. Susan. It is February the 22nd, the Saturday this is due. I have my deck here. I'm going to shuffle 1 time, 2 times, 3 times, and then I'm going to cut it in half. Okay, so I set that there. And then this is just the canvas of all the instructions. I have my 1-minute timer right there. And, let me set this up, move this cord. Cool. So I'm going to start my 1 minute. Sorry, real quick, say time, but go through the remaining cards. Okay, cool. So I got my 1 minute and I'm going to start now. The idea that people have the right to make decisions about their own lives is self-determination. Behavior analysts collect, represent, and analyze data accurately to make decisions is collecting and using data. Structured method utilized to identify highly preferred item or actions is preference assessment. The extent to which an intervention is fair, reasonable, appropriate is intervention acceptability. A 3-dimensional view that is social significance, social appropriateness, and social meaningfulness is social validity. The overall count of a specific bit of behavior, the number of times the behavior occurs, is frequency. How long a behavior occurs is duration. An observable and measurable action or behavior is a response. Behaviors that inflict harm on a person admitting the behavior is self-injury and self-injurious behavior. That's wrong. When one person purposely coordinates his or her focus to attention, joint attention, and that is time. It didn't go off, but that is time. So I'm going to move these aside so I can track for my graph, and then I will go through the rest. Includes all forms of communication other than oral speech is alternate, augmentative communication. The expression or demonstration of disapproval or unwillingness to participate in an assessment or intervention is assent withdrawal. Biased thoughts, use, or discriminatory actions against disabled people based on the false accusation that they're inferior is ableism. A compassionate approach to informing people that the things they say or do not cause harm to another person is by prevalently, that is calling in. An anti-ableist approach to viewing variations of the brain functions is skip. Approval of an assessment or an intervention by a person legally able to do so is consent. When interventions are realistic because there are enough resources is feasibility. When trusted family and friends provide useful information, skip. I don't have all of these memorized. I got most of them, but there's a couple. Represents the accuracy of which the intervention or independent variable is implemented is procedural accuracy. Everything the person is currently capable of is repertoire. Recommending a practitioner to complete an assessment, skip. Referral. The extent to which a person's quality of life is improved because they have greater access to new reinforcers and context, social meaningfulness. The extent to which an assessment or intervention is acceptable to the client or interested parties is social significance, social appropriateness. So that is wrong. A way of describing behavior and its topography and its function, what it looks like or its function in order to ensure, is this operational definition? Yeah. A standard observational assessment tool, skip, gotcha. Providing services based on the unique unique views of the client is person-centered care. Typically includes the analysis of the quality, quantity, and consistency of the scientific literature, is systematic review. Yeah. The range of tasks a professional can perform with their field because their education and training are scope of practice, scope of competence. When a person acquires knowledge or skills at a slower rate is intellectual disability. When the barriers experienced by disabled people are attributed to the environment or the attitude of others is the social model of disability. A chemical compound used to treat or cure illness is medication. A journal that appears legitimate but is not because it engages in unethical practice or safeguards is predatory journal. A broad category of behaviors that are characterized as strong preference for sameness is restrictive repetitive behavior. A cure is when a model evokes a physical response which is topographically identical, motor imitation. The range of tasks people certified or licensed is able to perform within our field of specialization. This is scope of practice. That's in the right pile. Asking other professionals for guidance when providing services to a client. The consultant maybe have a similar different specialization, is just consulting with other providers. Neurological conditions characterized by challenges in social communication, restrictive, repetitive use of object or speech. This is autism spectrum conditions. Cornbread conditions is also known as co-occurring conditions. An outdated term to describe interested parties. This is stakeholders. A standard interview that helps diagnose autism spectrum conditions is just autism diagnostic interview. The level of support needed for an autistic person to successfully navigate an equipment in a way that is associated with high quality of life is support needs. A brain disease where nerve cells don't signal properly, which causes seizures, is epilepsy. The process of differentiating between two or more conditions who share similar signs is differential diagnosis. When professionals from different disciplines collaborate to meet the shared goal of supporting clients, students, or patients, interdisciplinary collaboration. I think I butchered that first word, so that's wrong. The proportion of a population found to have a particular condition at a specific time is prevalence. A multidimensional measurement of a person's overall well-being and happiness is quality of life. Almost done. A range of strategies used in the process of determining why behaviors is dysfunctional behavior assessment. Client approval to proceed with an assessment is assent. Behavior shaped without directly contacting contingencies is rule governed behavior. The time between the onset of some environmental event and the target response is latency. The number of new cases per person per year is incidence. The extent to which the person or interested parties view the target goal worthwhile is social significance. The practice of alternating the way one speaks based on different expectations of different... Is this calling it? This is code switching. No. A research method where a small number of participants are under careful experiment. Single case design. A 5-point measurement system that required skip. I think the rest of these... Data collection method in which the behavior is recorded only if it occurs at the very end of the interval. Is that momentary time sampling? Adapting supervisee goals so they align is supervised cultural backgrounds, experiences. Is this cultural... we just read about the cultural sensitivity. I don't know. American Psychiatric Association Professionals Reference Book. Yeah, and then the last one is combining cultural responsiveness with active dismantling and oppression. Skip. That is all I have.